state officials, rather county officials, are ready for our local update. Now in the studios of WQLN, County Executive Kathy Dahlkemper.
Our Governor Tom Wolf, and Secretary Levine. And I want to thank them for their continued leadership during this very trying time across the Commonwealth. With that said, I appreciate the opportunity to speak to you today about further things that have happened here in Erie County. Today, we received our fourth positive case of COVID-19 in Erie County. This person is in their 30s, is from Erie County, and this is not a case of community-acquired spread, but it is a case of contact spread. So close contact, we know, is being within approximately 6 feet of a COVID-19 case for a prolonged period of time. Most normally, this is someone you live with, someone you work with, someone who you've been with in close proximity for a period of time. So with that being said, we now have 4 positive cases in Erie County, and 3 of those cases are connected to known positives. We do not have an outbreak of COVID-19 here in Erie County, something that was referenced by the governor in some of the other counties within Pennsylvania. So we want you to know that we do not have community spread that we know of at this point. Community spread is when people have been infected with the virus because they're in an area, including some who weren't aware of that or who don't know that they became infected. So it's more of the unknown versus the people we can trace back to an active COVID case. Contact tracing is being done or has been done in all 4 of these cases. And what that means is that we connect with the person who is positive, we find out who they have been in contact during the days that we believe they would have been infectious, and then we reach out to those people so that they know that they need to take precautions and quarantine themselves for 14 days. So the health department, again, is investigating the lifestyles, the work, locations, the daily routines of all the positive cases, those 4 cases in Erie County. After talking with the 3rd case, we are aware of a group of individuals who have been exposed to that individual. I want you to know that we have been in touch with them. We are working with them very closely. In fact, I've spoken directly to one of them, and we've helped them to identify ways in which they can come into compliance with our requirements after being in contact with someone who is positive. If you who are watching this have not been if you who have been watching this have not been contacted by our Erie County Health Department, there is an extremely low chance that you have to be concerned with the current positive cases identified here in Erie County. If you have been in direct contact with any of these individuals who have been identified as a positive case, you will have been notified. You will have been asked to quarantine yourself for 14 days, and as long as you don't have any symptoms within those 14 days, then you can go back to not being quarantined. Again, I urge all of us to keep social distancing because, as you know, social distancing is the best way that we can avoid having what we call community spread here in Erie County. As you know, enforcement of Governor Tom Wolf's order to close all non-life-threatening businesses began this morning at 8 a.m. Our environmental task force at the Erie County Department of Health started making rounds this morning, and they are here, they are there in the county department, and they're out there in the field to answer questions and help our businesses be in compliance. They have visited 10 locations today, and they have only had minor issues identified, and the public and the businesses have been very cooperative at this point with our inspectors as they go out. And I thank those businesses that we have visited and all those who've been compliant and didn't need a visit today. We urge you all, if you go out to a store, know what you're going in there to buy. Don't browse, go in, be direct, get the items that you need in the grocery store, in the pharmacy, and then find your way out as quickly as possible. Regarding waivers for businesses in our community, the governor talked about the waivers and how many thousands they have gotten. We still have not received a list of the waivers for Erie County, so we are awaiting that list. If you are a business who still believes that you are eligible and need a waiver, visit our website at eriecountypa.gov. The link to the application is available under our COVID-19 page under Resources. And if any business or any individual, again, has a question or a concern about enforcement or symptoms, you should contact our health department, and the number is 814-451-6700. 451-6700. Another important note, you should only call 911 with a life-threatening emergency. We have had too many calls to 911 today that are not life-threatening emergencies. Any 911 call received related to a non-compliant business will be asked, just mentioned, 451-6700, rather than us dispatching to local law enforcement resources. So we're trying to use the resources that we have and not tie up those important emergency resources with things that can go through another channel. And furthermore, I encourage everyone to be mindful of our neighbors and our fellow citizens. Please do not hoard food. Please do not hoard other supplies. Purchase as you normally would. And if we all do that, there will be plenty in our stores, our grocery stores, our pharmacies, for all of our friends and neighbors. Now, I want to just reiterate a couple things that were said during the governor's press conference. Pennsylvania's numbers today are 645, because there is one further number from Erie County that we know is not on the list, as mentioned. But that is up from 371 just on Saturday. So as Secretary Levine mentioned, these numbers are going up exponentially, and this is what we in Erie County are trying to fight and keep from happening here in our own community. Allegheny County, a county so close to us and so connected to us, was at 28 on Friday and now is up to 48 today. Again, we are working diligently day and night to try to avoid these same kind of numbers in Erie County. And we, those of us working on this every day, including our Director of Health, Melissa Lyon, we believe that we can do this. We can stop from having the spread that we've seen other places if we continue to all work together, to stay home, to stay distant, stay that 6 feet away from anyone you might encounter, and quarantine yourself if you have been in connection with anyone who is a positive case. So lastly, I want to just repeat that we are grateful for what all of our businesses are doing, for what all of our citizens are doing, so what all of our community is doing to pull together to make sure Erie County stays a county with minimal cases and saving people's lives here. And now I'd like to open it up for questions. First, I will open it up to Jet TV.
Yeah, hi Kathy, Samir. So I want to circle back to these cases, and you were saying how they might be connected. So do we know if that's from, I guess, a work relationship? Were they hanging out outside? Were they socializing, not really keeping socially distant from each other?
We know that they are connected to each other because of their close contact, either through living together, working together, or having social contact with each other.
Are you able to disclose if they live together?
I can tell you that the 4 cases that we have are not related to each other. I'd like to ask Erie Times News, do you have a question?
Kathy, yeah, it's David Bruce. Can you tell us, have the 3rd or 4th cases been hospitalized, and any update on how sick they might be?
No one is hospitalized to our knowledge of those 4 cases. They are all in their homes. They are in isolation. a little bit different than quarantine. We ask them to be completely by themselves, using their own bathroom, if they are a positive case. And so those individuals are all isolated in their own home.
And if you can, Kathy, can you describe again, it was a little bit garbled, the definition between close contact spread and community spread?
Sure. Close contact, according to the Pennsylvania Department of Health, is being within approximately 6 feet of a COVID-19 case for a prolonged period of time. And I want to go back to my notes so that I do this right. Let me get to the paper here. Close contact can occur, close contact, again, can occur when caring for, living with, visiting, or sharing even a healthcare waiting area if you've been in close contact and within 6 feet of an individual who's positive, or having direct contact with infectious secretions of a COVID-19 case, such as someone coughing on you. A community spread is when people have been infected with the virus in an area, including some who are not sure how or where they came infected. So we see that virus spreading within an area where people have no idea how they got it. They do not have any known contact with some person, some individual who is an active COVID-19 case. I'd like to now ask Erie News Now.
Hi, it's Ethan Kibbe. You say that we're seeing cases start to explode a little bit more in Allegheny County, the Pittsburgh area, obviously going up exponentially here in the state as well. I know you're saying you're hoping it won't happen here, but is there any reason to believe that that is realistic, that we won't see what these other counties are seeing?
I believe it is realistic, and I think we can actually make it happen. We're a smaller county than many of the counties where we have seen this exponential rise. From my visual observation, as I have been out, I wish I could stay home, but I have to be out because of my position. I have seen that people are doing the right thing. I have seen a lot of social distancing, but I think we still have to continue to put that message forward for those who may still think that this is not important. So I think if our community continues to do what they've been doing, and more people that aren't doing it come and join us in the social distancing that we're doing, we can do that. We can change that curve here, as they were talking about. We can stop the numbers from growing, and we can stay in a low number of positive cases.
So the hope then is that they had cases kind of beforehand. We've had this relatively small number, and so while they're dealing with this, the idea is maybe we're a little ahead of the game and have the chance to nip it in the bud, so to speak.
We are ahead of the game right now, and we need to stay ahead of the game. And we need to learn from our neighbors, not only across our Commonwealth, but our neighbors across this globe. And there is a team of people here that have been working hard, and I've been out here every day talking because I don't think we can say this message enough, and I really appreciate the media's opportunity for me to give this message forward and your continued assistance in getting this message forward. And that's really how we're going to do this, is if we heed the examples and the recommendations set out there, as I said, not only through our Commonwealth, but globally, and we take what we can learn from others, and we do better here. Erie Talk
Thanks.
Radio.
Hi, Kathy. It's Joel Natale from Talk Erie. There's a social media post out there from an Erie doctor, and in it she states that it's taking 6 to 7 days to get a test result returned to Erie. Is that still correct, or has that been greatly improved in the last few days?
That has been greatly improved in the last few days, although we do know there still are backups at some of the labs. So in the beginning, it was sometimes taking even 5 or 6, even 7 days. Yesterday, I believe it was yesterday, one of the cases, I believe, came back in less than 24 hours, so one of our positive cases. So we are seeing an improvement in that. It still needs to be better.
And do we have a number of negatives for today?
The number of negatives? Is that your question, Joel?
Yes, ma'am.
I'm sorry, I don't have that number, but I'll see if I can get that before we're done here. WJET TV?
Yeah, Samir again. So we know that Governor Tom Wolf just enacted, I guess, stay-at-home for several counties, Allegheny being one of them. So I guess if we are so far ahead of the curve, are you looking to possibly implement that?
So we're hoping we don't have to. I was looking at the numbers of those counties, those 7 counties. All of them have at least 40 positive cases within their counties. We have a few other counties who are in their 20s with their number of cases who are not on that list. So again, with 4 cases, I think we're still at a place where if we all do the right thing and social distance, 6 feet away, do the proper hygiene, that we can avoid shelter in place. But I'm not saying that that would be something we wouldn't consider if we see a change in Erie County.
And then also, where was this 4th case tested? Was it at St. Vincent or was it a primary care office?
I believe it was a test that came through the Allegheny Health Network. And I would now like to go to Erie Times News.
Kathy, it's David again. Can you tell me a little bit more about the size of the group involved with that close contact case?
So the group is, let me think. The group is a number of people, but they're less than 10. The exact number I'm still trying to determine, but less than 10. How about Erie News Now?
Hi, I'm afraid you're still stuck with Ethan Kibbe here. Question for you about going and checking on businesses. What's that protocol been like? You know, what have your team's been seeing? Do they just go to business owners and say, hey, you need to close? You know, are business owners not aware of that? Just as you start enforcement today, how has that gone?
So we have a protocol set in place. The first thing we do is call the business and inform them that they need to be closed, and we ask them to do that within an hour. Many of the businesses are doing that, but we always follow up. So we send a team out then of 3 people, and they go out and they just confirm that the business has closed. And again, we've had very good cooperation from the businesses. I think some maybe just didn't realize that they were one of those businesses that need to shut down, and we expect obviously those numbers to decline as the days go on. We also have had a number of businesses who are allowed to be open but maybe need to change their practices. So we are working with them, and over the weekend we were doing a lot of this work also, and we again had very good response from the businesses. They were grateful for our guidance, and they want to do the right thing. And so they want to hear from us and learn how they can continue to serve our community in those life-sustaining ways that they are doing, but to do it in a way that keeps everyone, not only those visiting their business, but certainly those who are working for them also. So I'm very thankful for our businesses in Erie County and the work that they're doing to try to comply. Talk Erie?
Thanks.
Do you have another question, Joel?
Hi, it's Joel Natale again. Could you define the difference between a stay-at-home order and the order that we're living under right now? Because it sounded like the governor was encouraging people to get out in the sunshine and you know, that there wouldn't be a limit to go to get groceries. I guess I'm really confused on what that means.
So I'm going to give you the best to my knowledge that I know, and I need to probably get a little bit more information myself. But to stay at home means pretty much exactly that, unless you have to go out to get groceries, to go to the pharmacy, to do something to keep your family fed and taken care of medically, that you should stay at home. I don't believe that means you can't go out in your backyard or your front yard or wherever and stay 6 feet away from anyone else that you might see if you live close in proximity to other people. But it means to stay at home and not go other places. In Erie County, we're not asking for that yet. I've seen people fishing. I've seen a few fishing boats out on the bay. I've seen people taking walks. I've seen people, obviously, at the grocery store. But wherever I've seen people, I see people really working hard to try to stay 6 feet away from others. I would say and I'm just going to bring one issue up. If, say, for example, you are going fishing, you should only be going fishing with people that are in your family, people that you're with on a normal basis, because if you suddenly go fishing with your friend who's in another household, then again, that's not really staying away from people 6 feet. So if you're in a boat, I guess. So maybe you could stand 6 feet away from each other along a pier and chat back and forth, but you know, we're trying to allow people to continue to have as normal of a life as you can in this situation, but using their common sense to stay 6 feet away, and that includes your best friend who you don't live with, because you never know who could have contracted that one way or another. And we have family members who have to go to work, and so they're coming home, and you know, you're with them in the home, and so we just want to make sure that everyone understands that unless you actually live with those people, you should try to stay 6 feet away from everyone you come in contact with. I can tell you at our Emergency Operations Center, we work very hard for every one of us to stay 6 feet away from each other. Our sign language interpreter, right beside me, we probably weren't as far away from each other as we should have been. We are now farther apart from each other. As I even walk around a room in the Emergency Operations Center, we are all making sure we try to stay that 6 feet. We're constantly bringing out our hand wipes, our sanitizer, we're going and washing our hands, cleaning surfaces off, doing everything we can, because we have to be at work, and that's what people need to be doing if they have to go to work, is trying to do those same things there, because we know that that's difficult, but it's so, so important.
Just a quick follow-up, Kathy. Should the mayor, Joe Schember, want to do a stay-at-home order like he did yesterday, I would imagine he would do that in coordination with you and emergency management, correct?
I spoke to the mayor. Obviously, he and I would talk about that, and honestly, if we were going to do something like that, it should be a county-wide. It doesn't make sense to just do something for the city. We all know that we travel across from the city to Mill Creek, and we don't think about even the fact that we've moved into another municipality. You know, everything is just way too close, and our community is really one whole, and that is Erie County. So the mayor and I have spoken about that, and we'll certainly be conferring with each other as we do on a daily basis. I would now like Jet TV. Do you have any further questions?
Yeah, it's Samir again, Kathy. So I kind of want to focus on medical supplies right now. So obviously we see the state's numbers when it comes to COVID-19 increasing. I think it's 165 today cases that are new. So I guess when it comes to medical supplies like ventilators and face masks, I know the hospitals right now say they're solid on supplies, but are we taking any preventative measures, I guess, to kind of stockpile on those?
Well, there's no way to stockpile except to hold on to what we have and not use it for things we don't need. So, for example, elective surgeries, which I know last week there were still some elective surgeries going. I believe this week there are none, unless they're, I use that word lightly and I'm not a medical professional, but there are some elective surgeries which really aren't elective, but they'll keep someone alive who may be having an issue and would have a larger issue that would hurt their health even a week or 2 weeks down the road. So those kind of surgeries, though, that people can wait on have been ended. I know that construction companies are looking to see if they have any supplies of what we call construction masks, which are which have now been allowed to be utilized by our medical professionals. Many are finding those and then handing them off to those who need them. And so those are the kind of things I see happening in our community. So I think we have a limited amount of resources currently, and we just need to make sure that we don't use those resources in any way that's not absolutely necessary.
And then I want to circle back to the stay-at-home order. I know you said right now other counties obviously have many more cases than we do. So is there a magic number, I guess, that is when you would start to really look at that?
So I just looked at the numbers after I heard this, just, you know, like you did a short while ago from the governor, and I saw that the smallest number in any of those 7 counties was 40, and of course in Montgomery and Philadelphia they're well over 100. So that seems to be the number the state chose, but I need to speak with our fellow state representatives, not our legislative, but our state officials, and find out what the guidance is from them, and we will be doing that. But you know, we can make our own decisions here in Erie County. We don't have to wait for the state. And again, we have our own health department, and I've said this pretty much every press conference, and we should be very, very grateful that we do. So we are able to make our own decisions here on some of these issues, and if we saw things starting to rise quickly in community spread, we might pull the trigger on a stay-at-home, order before we get to 40, so that we can really nip the community spread in the bud, as they say. How about Erie Times News, David?
Yeah, Kathy, we all saw the video the last couple of days about the kids down in Florida on spring break. Have you been in talks with the health department folks about, I mean, if some of those kids are from this area returning home, do they need to be, self-isolated for 14 days or anything like that?
I don't know that we've had any specific calls that have come into the health department about anyone's young person, child, friend, neighbor coming back. It was irresponsible, in my opinion, for those young people to be gathering in Florida or wherever they might have been for spring break. I would recommend, and I know it's a recommendation of the health professionals, that anyone who comes into our county from another place in the country, that they quarantine themselves for 14 days and do not go out into our community and just stay in place. And watch for symptoms, and if they have any symptoms, and we all, I think, know the symptoms. If you don't, you can go on eriecountypa.gov and you can find those symptoms. But if anyone has any of these symptoms, then they should obviously call their health care provider. But it is a concern. It's been brought up a couple times about people coming to our community from other areas where they have many, many more cases, and they do have community spread going on, and that's what we're trying to avoid here. So I ask everyone who's listening, watching, that if they know of a family member who's come in from another place, that they ask them to quarantine themselves for 14 days and keep our community safe.
And then speaking of the quarantine, did you get to talk to Mercyhurst officials about how their quarantine went?
So we did have a circle back with them, and they have all exited, those students, as of Saturday. There were no cases of those students that were left on campus who became symptomatic during those days where they were quarantined on the campus, and they've all gone back to wherever their respective homes were. And I thank Mercyhurst.
No reports of them being tested positive in their home counties over the last week or two.
We haven't gotten any. And I thank Mercyhurst, for their efforts in this and keeping those students here, and they've been in contact with those students directly. We have not been at the health department, but I appreciate their help. Erie News Now?
Sure. One quick clarification and a question, if I may. Just wanted to be absolutely certain on this, that these 4 people, there is some sort of a relation between them, but they're not related to one another, in any biological sense, right?
Yes. 3 out of the 4 have a relationship
3 of the
to
4,
each other.
okay.
The one is someone who we know traveled out to another area of the country, and another area of our country, and so that person is not connected to the other 3. Mm-hmm.
Alrighty, and even though our numbers are relatively low here, well, incredibly low here, actually, as testing start to ramp up, in fact, Hammett adding one, tomorrow, I believe, do you expect that we will still see an increase in numbers, even though you think that we're ahead of the game? Do you think our numbers still will go up here, and any clue for how long that may continue?
I don't think any of us can answer that question. I wish I had a crystal ball on that issue. We do believe, as we do more testing, we will discover some others in our community who have COVID-19, and we want to know who they are, so that we can do exactly what we're doing now, and having them isolate themselves, and again, contact those who they have been in close contact with and get them to quarantine themselves. We need to know that information. We need to know it as soon as we can find out, and we need to know who the people are who are even being tested, because once someone's tested, we ask them, if they're going for testing, we don't want to wait for the results. Once they know they need to go to be tested, they need to quarantine themselves until they find out what their results are. And if they've been exposed to someone who they know had COVID-19, even if they test negative, they need to stay quarantined for 14 days, because symptoms could happen even after they were initially tested. So there are guidelines that we are putting forward, and we have all of that information on eriecountypa.gov. Please check that website, and if you have any questions, you can call again 451-6700. That's our number at the Erie County Health Department, And we have experts there who can guide you, because I know everybody wants to do the right thing, and everybody is trying to do the right thing. And those who have been affected, and even the people that they have been in close contact with, I will tell you, having talked to them, they all want to do the right thing. They want to save lives in this community. They want to protect the people they love, the people they care about. And they contracted COVID-19 under no fault of their own, and they want to do the right thing. And they're all young people, and it's very difficult for any of us to be quarantined for a long period of time. But again, I thank them for being willing to do a sacrifice, and they really are heroes for our community because they're doing the right thing. And I will go back to Talk Erie.
No more questions, ma'am. Thank you.
Any more for Jet TV?
Yeah, really quick, Kathy, are you able to disclose, I guess, which of the 3 cases you believe are connected? Would it be like the first and the last 2, or?
Well, I think when we had case number 2 come out, we said it was because of a travel and a cruise. So there you go. And so number 2 is not connected to 1, 3, and 4.
All right, and then another question, I guess. So you mentioned the spring break, like people going down there, obviously the kids on spring break, that was kind of foolish. But what about places like WabTech and Lowe's? I mean, I think it's safe to say people at WabTech or who are going to Lowe's are not staying 6 feet apart from each other.
Well, we have asked them to do that at every one of those places and to find a way to keep their employees 6 feet apart. WabTech did receive a waiver from the state. They have put out some communication, I believe, to their employees that they are stopping some operations that maybe aren't as connected to life-sustaining operations, such as keeping our rail moving across this country. But WabTech will continue to communicate to their employees what they are doing there. We are willing to speak with any business, whether it be WabTech or Lowe's or any business, about how they can best do that. And we have the experts in our health department who can help a business navigate through this if they are the ones staying open. We've been helping businesses. We want to continue to be out there and be a resource. I personally have offered this type of service to WabTech, and offer it to any business that wants us to, just to come in and review and make sure they're doing what is necessary. Erie Times News, do you have any further questions?
Kathy, just want to confirm again, 3 and 4, would you classify both cases 3 and 4 as close contact spreads then?
Both came into this from close contact, yes.
Okay.
And Erie News Now, any further questions?
Sure, last one for you. How have the efforts been going to track down people who might have come into contact with that first case before he or she was put in isolation?
Very good. We had excellent cooperation from Case 1, and we were able to connect with those people very shortly afterwards, and that's what we do. Unfortunately, we didn't know about Case 1 until Case 1 was positive. And what we need to know is we need to know when the person is tested, and they get what they call a person under investigation number, and we get that number. Once we get it, we can connect with that person and say, you have to stay quarantined until you get your results back. So we're doing that work, and we will continue to do that work, and that's why your health department is so important, and that's why the information, if you're at all unsure, look at our website, eriecountypa.gov, call our number, 451-6700. We are the resource that you should find to be the trusted resource in this community and help you, and you have a resource that 57 counties don't have. So please use us, whether you're a business, whether you're an individual, whether you're a concerned citizen, and we can hopefully give you the right information, because what the last thing we want is for people to start panicking. If you have not been contacted by the Erie County Department of Health, then you have not had close contact with any of these 4 cases. And I'll repeat that. If you have not been contacted by the Erie County Department of Health, then you have not had close contact with any of our 4 known positive cases. That's important for people to understand. The last thing we need in our community is for people to panic around this. As long as you are staying home, staying 6 feet away, whether you're at work and have to be at work, or whether you're out walking your dog, or wherever you're at, we believe that you will help us really keep down the numbers and stop us from getting to a place where we call it community spread. And we continue to need your help, our citizens of this community. You've done this so far. It's not been easy. I know kids are probably crawling up the walls. I was a mother, I still am, a mother of 5, a grandmother of 8. I understand how difficult it probably is for many families to be at home every day with your kids. Try to be creative. There's so many resources online. People trying to help each other with what activities you can do with your children, what activities you can do with each other to stay busy, to stay active, to keep your mind occupied and to keep your children's minds occupied. And I just ask all of us to continue to reach out through social media, through telephone calls, to our friends and family, to our neighbors. Check in on people. Ask them how they're doing. If you cannot find the resources you need, call 211. They'll direct you to the resources you need. And so all of us working together, supporting each other, we will get through this. So with that, I want to thank you again for joining me here today. I will be here every day at approximately 2 p.m. or later if we have another press conference, as is the governor's, that needs to be covered first. But I'll be here for you, and I'm going to answer your questions. So I ask all of you again, stay home, stay safe, and stay calm.
You've been watching a live update from Erie County Executive Kathy Dahlkemper regarding the COVID-19 outbreak and how it's affected Erie County. In case you just tuned in, just a couple of the highlights before we send you back to regular programming. The county executive revealing that there has been a 4th positive COVID-19 case identified in Erie County, the person in their 30s from Erie County. That would make 3 people in their 30s and 1 in their 20s, so all the cases in Erie County relatively young. Another important point she made was that the last 2 cases that they've identified are connected to the first case now. So 3 out of the 4 are connected by what they called a close contact spread. And that is a group of people who were within 6 feet of each other for a prolonged period of time. Now that differs from community spread. She said Erie County does not have a case of community spread yet, which the example she gave would have been if you got it from touching a surface that maybe somebody had coughed on earlier. She said Erie County does not have community spread right now. 3 of the 4 cases were from close contact spread. So as of this afternoon, one more time, we want to say that we're confirming 4 cases of COVID-19 in the community, 1 more than yesterday. As of noon today, still no cases reported in Crawford or Warren counties, no cases reported in Chautauqua County, New York, 2 confirmed cases in neighboring Ashtabula, Ohio. You see the numbers on your screen right now. Across Pennsylvania, there are 645, adding the one in Erie County that was just identified, 645 positive cases of COVID-19. 6 people have died. More than 6,500 people have tested negative. So until further notice, what do? The best advice, as they said, stay calm, stay home, wash your hands often, and practice that social distancing of at least 6 feet. We want to remind you that Jet 24 carries a live digital exclusive coronavirus newscast every day at 11:30, 3 o'clock online. The next one will be at 9 p.m. on YourErie.com. We'll have the latest updates on COVID-19 anytime on YourErie.com. And of course, a complete wrap-up of the latest developments tonight on Jet 24 Action News beginning at 5 o'clock. We now return to regularly scheduled programming. Good afternoon.